Hey, practice owners. We're here for another episode of Coming Back Stronger. If you don't recognize our guest, by the time by the time we're finished, you'll either appreciate him or you'll just turn it off. I personally appreciate everything Steve Mautner says. So,
I would turn it off,
I,
maybe.
well, I
I
think
couldn't hear
you.
it myself.
Yeah. So, Dr. Steve Mautner, you are like a legend on social media. You have, one of the things that I think people could criticize you for is being really subtle in your approach and, not saying what you feel and, what you think and beating around the bush sometimes,
Yeah.
or literally the opposite. But, I think that's good. I think that any dialogue needs a voice from both sides. You and I agree on a lot of stuff. And I think we agree because we look at the business, the practice ownership side of dentistry, not the dentist side. And the practice ownership side is, you run a business, like it or not.
Right.
And, we were talking earlier about the whole coronavirus situation and how to come back. And I wanted you to kind of share with the listeners and viewers the perspective you have now and what some practice owners can be doing. And if you would share, your practice is very unique. And I think that's, it's interesting and it's important to know that there are all kinds of practices. But at the end of the day, you still run a business. You still have to have a profit to pay the bill or pay the bills and still have a profit left over to pay you. So,
Right.
so how's things in Florida?
Not bad. It's very boring because we can't do much. But I actually, if it wasn't for the fact that I'm only working a half a day instead of a full day, this
Mhm.
wouldn't be so bad because I have an excuse not to go out with friends for dinner that I don't want to see, and it's like I have a great excuse to be lazy and sit at home, which I love doing anyway.
Uh-huh.
But things are good. They closed up pool at the condo, which is kind of stupid.
Ah.
Now they want us to wear masks in the lobby, but I sometimes I do it, sometimes I don't. It just depends on my mood and
Mhm.
like the afternoon guy is pretty cool. He's not wearing a mask either, so he doesn't bust my chops.
Yeah.
But things in Florida are good. It's getting hotter, which
Mhm.
is actually a good thing. Maybe it'll kill off the virus. I've been counting on the Florida heat to kill off the virus.
Right. So,
So
and and you see, so your practice is not a little different. Your practice is like a lot of practices, but you don't hear about it sort of in our industry. They don't get talked about a lot. What gets talked about a lot are the programs and a lot of the things that dentists hand off to a consultant or whatever. And you have a very, if you share your father was a dentist, your dad was a dentist,
yeah,
and you kind of learn dentistry in that, in New York that way. So share
right.
that for anybody who doesn't know.
Well, yeah, my grandfather was a dentist and my dad
Yeah.
was a dentist, and that's why I chose dentistry because of the life we lived. And my grandfather always told me it was recession proof. My
Hmm.
same thing. My dad said the same thing. Plus, he said you could be your own boss. And my dad was a ruthlessly independent guy. No one could tell him what to do. You know, no one could tell him what to do, including me. So I like that. I mean,
Hmm.
it's very a powerful statement when you see a guy just doing what he wants. He followed the laws. He was a nice guy. But if someone tried to boss him around, that guy was history. I mean, there's
Hmm.
no way he was ever going to listen. So as a dentist, you have that luxury. You could do that. You could
Right.
work on who you want. You could work the hours you want, take the times off you want, make decent money. So that was the main reason why I became a dentist because I knew I'd be able to survive any economy,
Hmm.
anything. So this is this coronavirus thing is a unique challenge because I had to cancel hygiene and
Right.
exams and also a lot of patients canceled their appointments because the media scared the hell out of them.
Hmm.
So like my patient flow is down probably maybe 3/4,
Okay.
which is not so bad because I don't have the hygiene area now. The hygiene creates a lot of traffic in the office, sometimes a lot of stress. I don't make a lot of money off it. Like I'm not a hygiene driven practice.
Okay.
I'm a practice that has to provide hygiene because no one's going to a dentist that doesn't give you a cleaning, but
Hmm.
I'm not a hygiene driven practice. But what's helpful about the hygiene is the patients come in for the exams and sometimes I'll do a lot of unscheduled treatment on those people that come in for the exam. So say they're
Okay.
here for the exam and the cleaning and I see that they need a crown or even just a few fillings or another denture, whatever. I start unscheduled work on them. So that's a boost to my production because it's unscheduled production. and that adds to the bottom line. So I've lost that aspect of my practice. But it's a little relaxing because the hygiene is a lot of drama sometimes. You know, one girl will always see one or two more patients than the other. The other one drags it out and then rushes right before lunchtime, so she has her hour lunch. You know, it's all that kind of nonsense going on. It's annoying. So now there's none of that right now.
So it's a little bit of a staycation for you.
Kind of, and it's nice coming home in the afternoon. I'm taking naps in the afternoon, and I'm more tired now than I was when I was working 8-9 hour days. I'm exhausted. I'm working 8 to 1. I'm like, I come home, I can barely keep my eyes open.
Yeah.
Weird, huh?
So how do you, you know, again, you have a very unique practice. You see a lot of patients.
Right.
And you see a lot of like unscheduled patients. They, you know, there's your schedules, the blocks are filled, but then there's just whoever shows up.
Right.
And I like the way that you sort of approach that is you're just doing dentistry. You're doing what's in front of you today, and you built this momentum. So, you know, how do you see when you come back? There's going to be changes. Let me just say this. We don't know what they're going to be. None of us know what they're going to be. Infection control changes, and you know, the ADA has a directive, and I don't know if anybody even knows what that is or if it's clear. So for somebody who's listening or watching, they're looking for that. They're looking for clear direction because they have that dentist personality, that methodical.
I'm looking for no direction. I don't want to be left alone. You know, I just want to go to my office and continue seeing the patients I was seeing. We've rescheduled all our hygiene into May and June, and most of them are rescheduling. But I suspect a lot of them will still no-show at that time. So I think I'll be busier than I am now, but I'm not going to be where I was, say, like in February. But I'm afraid that the ADA, they're like a pandering type of organization. They're always trying to convince the public that it's safe to go to the dentist.
Right.
You don't try to convince people that you're safe, because that implies that you're not safe. It's like, oh, I didn't beat my wife. You know, once you say I didn't beat my wife, you beat your wife. Everyone knows it. It's like Paula. It's like what that Carol Baskin lady in Tiger King. We all know she killed her husband. Right. So that's it. I'm afraid the ADA is going to do. They're going to become Carol Baskin, and they're going to try to be proactive in quotes and try to propose more stringent PPE requirements, just so that they think that the scared public will return to the dentist. I think they should just leave us alone and maybe let the dentist decide, or let the states and let the CDC decide. Just don't do anything, and advocate for dentists just being open. Say that the dentist is a safe place. We've been practicing infection control for decades. We've survived AIDS, hepatitis, all these other viruses, and there's been very few cases of disease transmission in dental offices. Normally, it's when the dentist doesn't autoclave things or is just a bad guy. But your typical dentist adhering to infection control protocol, there's no problem.
Yeah, they're doing it. And that's really a thing that struck me. You know, when all this started, I told Paula, my wife, you know, she said, what about dental offices? And I said, you know, they're probably one of the most hygienic places anyway. I mean, it's constant sterilization. There's constant infection control. There's infection barriers on everything. And, you know, so I was shocked when I heard all this, you know, a dental office is a terrible place. And I think I agree with you. I think I think you need to be careful with your messaging. If suddenly you've changed everything and you want to communicate to your patients all these things you're now doing to be hygienic, I think there are a lot of people who are going to say, well, wait a minute, what was it before?
That's right. But all these dentists are racing to inform their patients what they're doing. Don't talk to your patients. First of all, they don't want to hear from you. They're all unemployed and broke and waiting for that $1,200 stimulus check. Right. They don't want to hear from the rich dentist. So I didn't contact anybody, and I'm open. And I'm the only thing that's different now is I'm taking all walk-ins. And when I go back to full time, I'm probably going to relax my morning walk-in only requirement. I'll just let people come in all day until things return to normal, and then I don't feel like working late anymore. I'm just going to relax that. And also I'm going to allow people to wait in their car, and we'll call them on their cell phone when the chair is open. In the past, I've had patients say, you mind if I leave for a while and just go to Publix and come back when it's my turn? And my policy has always been, you leave, you lose your place in line. Because what happens if I'm done with the other patients and then he comes in like a half hour late and then I'm behind because of him? But I'm going to relax all that kind of thing. you know?
Well, and I think that maybe in the spirit of coming back stronger, that's a smart way to look at it. I think a lot of docs in my conversations feel like that they put it on pause and they're not going into the office and they're not seeing patients. In fact, they're not answering the phone,
Well,
or they've got somebody checking messages every morning.
Yeah, I think they should, if they can't, if they first of all, they should go into their office at least 2 hours. And if no patient comes in, at least go through the mail or whatever, do something, or organize a supply closet or check your inventory. Like I switched to years ago, order on what I need inventory. I'm not overstocked for anything. So Elizabeth, she reorganized our supply area in the lab, and so we saw that we had some things too much, some things too little. It gives you a chance to get organized. We threw out some old plans that I used to take, their fee schedules. We have different books for each insurance. We organized that. So there's always something to do. But I think the dentist should be in their office. If you work, go in at 8 o'clock, stay there till 10 o'clock. You never know who calls. You never know, because a lot of dentists are closed or they're afraid to work. And sometimes one emergency patient could, be very lucrative. And even if it's not, they know that you're open and they're grateful. And then they'll tell their friends, hey, this guy was open. I was in pain. He took an x-ray and wrote me an antibiotic. That was so nice of him. The patients that I'm seeing are thanking me for being open. Some of them are surprised. Others are, they're thankful. I said, why? Since when do only COVID-19 patients deserve health care? That's not our only disease in this country.
Right.
They act like those are the only people that deserve health care. COVID-19. If you're not COVID-19 infected, we don't want to hear from you.
Right.
Go die in the corner.
There's a lot of that. Yeah. Here's the other thing is, I had a conversation with somebody the other day that said, 70% of dental emergencies are seen in an emergency room. We already know that. So that's a lot of people who went in with a lot of, extreme dental emergencies that should be going to the dentist. In fact, I was work with a practice several years ago where the doc was on staff at the hospital as the emergency dentist.
Right.
And when they get a dental emergency, they called him in. And I think a lot of them are like that. Well, now they can't go to the emergency room.
Right.
So they're going where I talked to a guy yesterday or the day before that said he's seen all kinds of interesting cases that he's never seen. And it occurred to him that they've been turned away from an emergency room. So he started asking, and that's exactly what's happening. They went to the emergency room. They said, if you don't have the virus or a gunshot wound or, a knife sticking out of you, get out of here. Right. And so they start calling down the list, and whoever answers the phone is suddenly their new dentist.
Exactly. Most of the patients I've seen are my patients. I've had a few new ones, but most of them are existing patients. But even existing patients, they have a new problem or a problem that you told them about last year that was going to be an issue. Of course, it flares up now. So those people deserve care. And to be honest with you, I still need to make some money. I'm not. If I had the funds to retire, this would be a great chance to retire, but I don't. So I have to generate some income. And even if it's not at the same level it was before the shutdown, it's still something. Every bit helps.
Right. Well, you said something interesting about how you will relax some rules temporarily. Right. And so that's the other thing. Everybody's guessing or speculating, but kind of what I see is smart docs understand that there's about a 60 to 30 day, or smart practice owners, 30 or 60 day gap where there are patients who were scheduled in that time and you didn't see them, and you're not going to see them for, let's just say, another 3 weeks or whatever it's going to be. You got two choices. You can push them till October and say, yeah, we'll just skip this one. But you're also skipping the revenue that came from those patients. Right. And if you are a hygiene driven practice and, $1 of hygiene turns into $3 of restorative, that's a fourth of your revenue for the year. Just gone. Right. So, so the alternative to that is saying, listen, we're going to schedule those people. So what we really have is, like, we had, 30 snow days or 40 snow days, and now we got to push them. So they're coming in, they're planning on working Fridays, working till 7, 2 nights a week or 3 nights a week, and prepping their staff for that. So that when they start working that hygiene schedule, they're going to say, listen, you don't want to miss your hygiene visit. I know it was, March 30th, but we're going to do it May 7th instead.
right.
And you feel that? I mean, you see that as, you see it as a trickle, or do you see it as, or is it how you handle it that makes a difference?
You can tell you handle it, but I still think it'll be a gradual return to the patients. I don't think like our elective shutdown ends May 8th. I don't think May 11th I'm going to have like 80 patients in my office, but I think maybe I'll have like 50 or 45, and then gradually, as people see that the world isn't coming to an end, and we're not all going to die, they'll come in because eventually people need to take care of their teeth, even if it's just an extraction. I mean, I've been doing a ton of extractions and root canals since this shutdown. It's really unbelievable. So they'll come back to patients. It just, there's going to be a hesitation period and a lull, and then eventually people will, they'll have to come in. The only negative to that is the unemployed people that either lost their jobs with dental insurance, or they don't have any discretionary savings. They may hold off until they come up with some funds or improve their credit. So I don't think it's going to be like exact return. I think it'll be slow, maybe 3 to 6 months. But so we'll see. I mean, but you have to work on whoever shows up, so you have to be there. I think most dentists, unless they really have the funds to just sit at home and watch Netflix, they should be in their office at least a couple of hours.
I think two things can happen in the way that we do it. It all really comes down to, I mean, you're spot on. It's not us, it's our patients. Our practice is open when our patients come back, no matter what the governor says.
Right.
So if the patients feel okay coming back, we're open for business and we're growing again. If the patients, for whatever reason, and we're in times where, we talked beforehand, things you can't imagine ever happening are happening. Patients may, there's something that may hold them back. I don't think it will, but you also have a situation where it's going to change. So it's going to be however patients are looking at you and you're interacting with the patients. And then to some degree, you're the number two, you're beholden by how many of these, what are we up to, 16 million jobs that people don't have?
Yeah, I think it's 22 million now.
22 this week.
Another five this week. Crazy.
What do they do? So restaurants that used to have, I don't know, 120 people on staff, do they still do that? When it's okay to go back? Are we social distancing? I've read where restaurants will now have to have a minimum distance between tables, and
I know,
who knows how that works out. But I guess my point to that is that impacts jobs.
Right.
So, there are going to be industries, I think, that people permanently just don't come back, or it takes a year to come back. And I don't think any of us can predict that or know what that is, but you're right. That's their dental insurance.
Yeah. And I have a lot of elderly patients, so I think some of them are afraid. Like the lady that's been coming to me for years, she called me up. She had a toothache, and she said, "Well, are you doing anything different?" And I said, "Look, I'm doing pretty much the same thing I've always done. I've always worn a mask, or gloves, wiped down everything, sterilized everything. I'm wearing a shield now." And I said, also, if you feel uncomfortable about coming in with a crowd, my office isn't as busy right now. So when you come in, if it's a little busy, go sit in your car and we'll call you on your cell phone. So she said, okay. And then she didn't come in.
Yeah.
That's all right. That's a typical dental patient. They ask you all these stupid questions,
right?
But they don't show up anyway.
Yeah.
That's why I overbook, because that's what happens. They always say they're coming in, they don't come in. When someone tells me I got to come see you, my eyes glaze over and I start thinking about what I'm having for dinner, because that's the biggest bunch of BS if someone says I'm going to come see you. They're not coming to see you. For some reason, people think that dentists want to hear that they want to come see you. I don't need someone to tell.
Yeah. Uh-oh. Did we drop you? I dropped you. No big deal.
All right. I think it'll take time.
Okay.
It'll eventually return to normal. Hopefully, it's a lot of it what's the government and the media does. If the media keeps scaring everybody, it may take longer.
So you overbook anyway. I mean, that's just your standard operating procedure for that reason.
I've always overbooked. Once I got busy enough, I started overbooking because it's funny with a person. Say you really only have an appointment like in 3 weeks.
Hmm.
They don't want to hear that. They want to get in sooner. So they may not make the appointment, or they may forget about the appointment. So if you put them in there sooner, odds are they probably won't show up anyway. So at least you pacify them, you give them the appointment. If they show up, you deal with it. You run behind. You apologize, offer to reschedule. But I always thought it's better to have too many patients than too little, because if you have too little patients, unless they all need like a roundhouse, you're not going to generate much revenue. But if you have too many patients, if you're really busy, you send a few home. If you're too busy, you just send a few home, or you don't do everything, you know?
And I think that's the neat thing. Elizabeth's home.
Hi.
Yeah.
How are you?
Somebody has to work, right?
Exactly. Exactly.
So
Hey,
you,
Steve agrees with us on this whole thing.
yeah. So she, hey, how are you? So Elizabeth she sort of runs so you got to leave early and she's at the practice and she's masked up like she's supposed to be.
I had to protect myself. Okay, keep talking.
She's always like that. She was like that before the virus.
But yeah, I think that is so my message to practice owners who ask me, well, how does that work? Is you've built a unique practice on your own, and you may not have a decision you can share with somebody and say, this is how I'm going to do it, but it is how you're going to do it that works for your practice. And, so yeah, you relax a few rules and until it trickles back. And I think the message is, even with staff, I'm guessing, I've had a lot of docs who say, I got my loan money, so I'm bringing everybody back because my staff, they need to feel like I love them and care.
Well, that's another stupid thing.
And
I'm not doing that, because this is kind of like almost like a communist inspired loan program. It's like the old Soviet 5-year plan where the factory has full employment, but they're not producing anything. They're just standing around. So why would a businessman who say your revenues get cut 50% and your patient flow is getting cut 50%, you do not need a full-time staff. I would rather use that money and treat it as a 2-year 1% loan than wipe it all out in 2 months, and then I have no cushion in case my collections don't pick up. So I'm not doing that. I've said that online too. I'm not doing that. Why would you pay an entire staff for a full week if you only need them half a week?
Right. Or you only have, your production is off by half and you've got 100% of your staff. You're losing money every day.
Yeah.
And, depending on how quickly your production comes up, you're going to run out of money.
So I don't want to run out of money. That's one of the goals of my life, not to run out of money. So the way you don't run out of money is, it doesn't matter if you have a big PPP loan sitting in the bank. You ignore it and see what money actually comes in and what patients come in. So like we're like rotating assistants now. No, I have 3 assistants, and now we're giving one a day off every. I'm going to do that until things pick up. And also the hygienists aren't there, so I don't even need a 3rd assistant every day. So when the hygienists come back, then we'll have a full staff. And then if I could pay the full payroll on my current revenues, I'll pay the full payroll. If I can't, I won't. I'm not gonna change my whole practice
together.
Yeah, the goal of my practice is not to pay off the PPP loan. Or have it forgiven. It's to make a profit. The PPP loan is irrelevant. It's nice to have. Now I have a friend who applied for that. He has a different kind of business. His revenues are only of 10%. So that's like a home run for him. He's gonna pay his
free money.
Yeah, it's free money. So he hasn't gotten it yet, but he applied. But like for most dentists, it's really not free money, because even me, I'm like probably 50% of my revenue. So why would I pay 100% of my payroll costs on 50% of my revenue? It doesn't make sense.
I think a lot of practice owners are going to get into a trap when that 8-week time frame comes up and the money's gone and the patients aren't back. And I think you have to be at 75% of payroll, and that it's forgiven.
Yeah.
And if you're not, then it rolls into a loan. But at the end of the day, maybe you got a point. Maybe if you start out thinking of it as a loan, then it's just a loan versus blowing that money for the sake of blowing money.
Anyway, politicians always want to get votes. So there's going to be such an outcry of people that got this PPP loan that couldn't get it forgiven because their revenues didn't return, or they were on forced lockdown by the governor of their state, and they didn't have the opportunity to make the revenues.
Yeah.
Now those loans are either going to be forgiven or modified in 2 years. There's no way everyone's going to doesn't pay those loans back in 2 years.
Right. It's a
Well,
tough
the
game
banks
to
will
play, though.
refinance them. The banks will refinance them, maybe.
Right. And at a whole lot more interest in, yeah. And so you've gotten yourself into trap. To some degree, when I got into this business many years ago, one of the first things I did on the consulting side was I would go into practice, and they would have 250 or 300 grand in credit card debt. And it's because, if you've practiced long enough, you know this, you would open your mail every day and you would get 3 envelopes that said, hey, you've been pre-approved for $50,000, punch in this code and bammo, you got a $50,000 credit card.
Right.
And doctors use that to pay payroll and not realize that there's a reason you can't pay payroll. Your business isn't generating enough, which means you probably have too much payroll. If your production's here and your payroll's here, there's a mismatch. So instead of fixing that, they would technically borrow money at 18 or 19% interest. And I think that's one of the reasons that bankruptcy was so high in dentistry going into 2008, 9, and 10, in that they were financing payroll on a credit card,
But I think that was also a personal lifestyle choice. Like I was in
Yes.
that type, I was living that type of life. I was living over my head. So, the practice suffers when you're living over your head because you're sucking all the revenue out of the practice to support your personal lifestyle. So
you're digging the hole deeper, I guess. And that's what I worry about with some of the strategies of taking this money is you're digging the hole deeper.
right.
And 8 weeks from now, your patient flow isn't back to what it needs to be to cover your overhead, but you've taken the money and spent it on, keeping people on scholarship or whatever.
Right.
And now you're in a bind. So part of me looks at that and says the problem isn't today as much as the problem is going to be in May, June, in middle and end of June,
Right.
when all these loans roll into being due, or all the forgiveness, is supposed to be due.
Right.
We forgot about it a month ago.
Right.
And, or they did the smart thing. They took the money, but spent it on something. And now they don't have, they don't have the patient flow, and now they're stuck with it. So that's the part of this that I worry about. We talked earlier about this is unprecedented. I don't know whose idea it was that the solution is to close things down. Normally our government would have been, the solution is, we're going to put $50 billion towards finding a vaccine and fast track that. But for some reason, our response was shut it down. And, it's an academic argument, but nobody knows what this thing looks like.
Well, that's the problem. It's the academics made that decision. Dr. Fauci and Dr. Birx. Those guys are they're academics with guaranteed salaries, benefits. They don't suffer the consequences of their actions. In fact, they're doing great. They're getting they're on TV every night. They get to talk. They get attention. They're living the high life. It's the rest of the country that's suffering.
Yeah. In fact, when this all comes back, they get to take a break. We have to go back to work.
Right.
And I think that's sort of the point of all this is you can either focus on all that and try and figure it out, which nobody knows. Nobody. I'm amazed if you turn the TV on, there's another expert on this. Who's an expert on this? I mean, it literally has never happened. So, in fact, last night, you probably would have appreciated this. I heard a guy talk a long time ago about, he said one of his favorite phrases was Soviet economist. And he was, I don't know, it was a guy I heard speaking. He was like the president of one of the Federal Reserve banks speaking at Indiana University. And he says, what is that? What is a Soviet economist? Yeah. We all know what the economy is, but he's an expert.
Right.
And he said, that's the great thing about being a financial expert. You can be wrong about 50% of the time and you're still an expert.
That's right.
Because it could go either way. Right. And that's really sort of what's going on here. We don't know. But you've got the choice of getting bogged down in that, which we don't know. And I think, my personal opinion is, I know you're a get up and work through it kind of person. But if you're going to come back, you don't have those answers. Don't wait till you have those answers. Go in, work some, do what you can do now, but you're still a practice owner. you and I have talked before. I think the dilemma in dentistry is most dentists don't realize they're the owner of the darn thing.
Yeah.
They hand it off to an office manager to make all the smart decisions, and so right now they're stuck. So
Right.
what any words of advice for somebody that is just sitting at home watching CNN or Fox News and trying to wait until they get the answer to go back, that are in that kind of hole?
Well, don't watch CNN. That's one thing.
Well,
But I think it's a good chance also to examine all your practice finances, because when the money is tight and you have to pay your own bills, you see which ones are not necessary and what's necessary. So there's a good chance to maybe cancel some services that are not vital, or maybe examine your supply ordering strategy. Like, obviously now, if you're taking in less revenue, you cut your staff hours, and also your supply bill should be lower, your lab bill. So maybe you could examine how you order. Order all your supplies, all those variable costs. And there are a lot of things in dental offices we waste money on that you could eliminate if you really check it closely.
Do you equipment? I've heard some people say that they called they got a big piece of equipment that they probably shouldn't have bought anyway, and it's certainly not. There's no ROI on it, but they've got a $3,000 a month payment, and call and say, "Listen, I'm not going to be able to pay you for 90 days."
Oh yeah, that right. I've done that myself with those type of situations. I've gotten everyone's given 3 months forbearance.
Yeah,
everybody. So you have to do that. That's the first thing. That's the first thing I did. I happened to be off the next week after the governor made our shutdown. So I called the 3 people that I have, like my mortgage, practice loan, and car. I said, I told them what happened. Right. They all gave me 3-month forbearance.
Yeah.
So that's the first thing I did, actually.
I think a lot of dentists, the dentist side, the dentist mindset, they're afraid of upsetting somebody. So, but this isn't normal. This isn't like you're in a cash flow crunch because, the economy in your little town is bad. This is everybody.
Yeah.
So just call. And I haven't heard anybody say no. Have you?
No, I've heard reports of people saying no, but no one said no to me. I mean, like with my office landlord, I paid him the rent this month because I had it. I'll pay it. But, let's see how it goes. If next month it gets tight, I'll call him. He knows what's going on. I'll call him. But I think I should be able to pay him because I'm able to get by because my variable costs are way lower now. My staff, my salaries are lower, my supplies are lower, and my lab is lower. So I think I'll be able to be okay with that.
I think a lot of docs, though, don't do that. I think that is one of the holes they get into. They don't do that every month, so they don't know all that money that's going out, and it adds up. And
I do my own bills. I don't have the office manager do that. I never understood this thing. I mean, if I owned like 5 or 6 offices, obviously I couldn't do it all myself. But in one office, you can't write a few checks every week, Well,
and I think a lot of people get into the trap where they have, I've heard it even on the personal side. You suddenly start saying, well, I'm going to look at my credit card bill, and you find out you have, Hulu, Voodoo, and things you didn't even remember signing up for.
Yeah.
Automatic things. And one of the things you can do, and your practice is full of those. I've never seen a practice that didn't have a lot of those things that are recurring payments. Right. That some of them are good. Some of them you should have canceled a long time ago. And, so now's a good time to get into that. And I mean, the worst case, your overhead comes down permanently from that. So right. When you do open up, you got, more cash coming in the bank.
Yeah. And then the other thing, I wouldn't cancel the marketing, because it's important to let people know you're out there. That's one thing I've never cut back on. I do a lot of direct mail. I've never cut back during hurricanes. Even now, I'm still advertising because people now that it's more important than ever. They're sitting at home doing nothing. So they get the mail. They look at the I got a new patient the other day with a broken denture from my ad. That every little bit helps.
So you're getting new patients in the middle of the shutdown.
Yeah, they're emergencies. They're emergency patients.
And so that right there is a powerful message. Look for that. Don't sit home and get stuck into the gloom and doom. So, well, any words of wisdom that you might have? You got a lot of them, I know. And
Yeah.
I appreciate them all.
Anything else? Let me just see. I think the main thing is you got to get into your office and make it known that you're open to see emergencies. And a lot of people are surprised that I'm open. A lot of the patients say, "Wow, I didn't even think you were open." I think the dentist has to be in his office, or if not in physically at the office, be close enough. If someone calls up, he could drive in and see a toothache. You have to be available to these people. It's not like a vacation. Like when I'm on vacation, I don't want to be bothered, but this is not a vacation. Unless you can afford to be on vacation. If you have savings and, you don't really need the money and you want to just chill out for a while, that's okay too. But if you're a young or medium-aged practice owner, you got to make yourself available to people. Well, you never know who you make yourself available to.
Right. And you and I have talked before about the secret to success is just going to work.
Yeah, just show up.
Yeah.
Yeah. So that's the words of wisdom, which is not really wisdom. It's just show up.
Right.
Huh?
And that's a good point. You're not on vacation. And if you treat it like one, even really, Steve, if you have the means and you have a nest egg, why do you want to burn it up right now? Well,
that's true. And also the value of your practice may decrease if you let it go. So right. Even though I know the practice sales are based on the gross, but if you could show a potential buyer one day that, hey, look, even during COVID-19, my revenues didn't drop as much as the other practices, I think that makes your practice much more valuable.
Yeah, yeah.
If you could generate money during this, that's a strong practice.
Mm-hmm.
Because a lot of businesses are doing the zero right now. So,
and you and I are the same. I mean, I've worked for myself for my entire life, and I have that. I also believe there's a lot of opportunity when things are down like this. People say nobody's buying. Yeah, they are. Somebody's buying.
Yeah.
I grew my first company during I'm going to date myself, the early 80s, the recession, when I would go into my dealers and they would say, "Oh, nobody's buying. The market's off, 18%. Well, so I'm not good at math, but so what does that mean? 72% of people are still buying. So
right.
While you're sitting here, there's a good parallel. While you're sitting here in your office watching the news and getting into these deep conversations about the market being off that much and it's a record and whatever, I'm going to go out and sell. Quadrupled my business in the exact same time while others went out of business. So I understand there's no, in that time there wasn't a virus out there, but the point of it is somebody's buying. Right. Patients still need to be seen. So.
Right.
All right. Well, I appreciate you coming on. I know you're a busy guy. You probably got a nap to take or something.
Either a nap or a run. I'm not sure.
How's everything good?
Oh, very good. Glad to see Elizabeth. We're recording this, Elizabeth, so you're on tape forever.
Bye.
Maybe I'm gonna try on some new masks maybe after we hang up.
Good deal. Well, it is always a treat to talk to you. I love your practice philosophy and love, I think the key to any business, our messages line right up. I'm not going to pass judgment on anybody's business that's profitable because that's why you're in business. And there's place in a market for everybody. And the way you do things works and it's profitable. And, look at it right now. Somebody who has that sparkly, beautiful new practice and is losing money, that's not why you're in business. So there's a way to make them all work. But what I appreciate and admire most is you found a way to make yours work. And, you're pretty comfortable guy and pretty comfortable in that skin.
Yeah. Well, I like seeing emergencies. I think people always have emergencies. So, you can't choreograph a perfect day in dentistry. Right. The best way to do it is just show up there because you never know what's going to come in or what's going to happen. And that's, you just deal with what's there.
Yeah. Just like you said, show up.
Right. Just show up.
Good deal.
Figure it out.
All right. Dr. Steve Mautner, if anybody wanted to get a hold of you, are you hard to get a hold of? You hard to find?
I'm in quarantine. You can't get a hold of me.
Right.
No, well, I have, on Facebook, they can message me on Facebook, or You want me to give an email address?
Yeah, if you, I mean, if you want to, if you don't mind people emailing you, and then I did want to mention Mauty's blog, which
That.
you did on Saturdays.
Yeah, usually I did one this morning because I hadn't done one in a while, but mostly on the weekend. That's when I have time to write. But I did one today because I had some thoughts in my head that were kind of annoying me, so I put it down.
It is Mauty's blog is always a treat, and it is you know, a great perspective and a great voice, and you know, I appreciate them all, and I appreciate them. I think in the spirit in which you do them. So
well, the best way is through Facebook. Either message me, you know, Stephen G Mautner, or Mauty's blog. That's the best way to reach me.
Awesome. All right. Well, it's good to see you again. Good to see Elizabeth.
Have a good weekend.
Always a treat. And practice owners, if you have any questions, or if you want to find out how to get a hold of Dr. Mautner, you can reach out to us at theprofitabledentist.com. And until next time, hope you get out and just do the work and come back stronger. So,
okay, take care, Steve.
See you, Steve. Bye-bye.
Bye.